Okay, so we're live, and once the viewers start to join in, then we'll start. ठीक है सर, आपकी तरफ मौसम कैसा है?
बस बल्कि कल रात से बारिश हो रही है और यहाँ पर तो काफी बारिश की वजह से मौसम प्लेजेंट हो जाता है ना काफी।
अच्छा, हाँ,
धुआंधार बारिश हो रही है।
yeah, it was raining today here as well, like yeah, for the whole day actually almost. Okay, so we have some viewers. So
Yes.
someone, if you can please confirm that you can hear us and see us clearly, please mention in the comments so we can start. Thank you. As I always say this, and then I always think I should probably check it myself. But so I have a comment. Naman, if you can please confirm that you can hear us and see us clearly.
Yes, I can hear you.
Okay, okay. So, Assalamu alaikum everyone. This is Rida Zainab from Creative Kinder House, and today I have with me Dr. Wahid Zaman. He is a psychiatrist, and he did his MBBS from Peshawar, right? University of Peshawar.
From Abbottabad, actually.
Okay, sorry, maybe I misunderstood. It was at university. Yeah, University of Peshawar. Okay.
Yeah, University of Peshawar is, yeah, so the university is the same, Peshawar, but the medical college is Abbottabad.
Oh, okay. No, it's okay. So, and you have been working as a psychiatrist for almost a decade now.
Yes.
Okay. So, can you please just tell us a little bit about yourself?
So I am, as you said, Dr. Wahid Zaman. I'm a general adult psychiatrist. I have worked in psychiatry for about 10 years. I initially trained in Pakistan, then moved to UK in 2003.
Okay.
United Kingdom, and I trained as a specialist psychiatrist and became a member of the Royal College of Psychiatry in United Kingdom, and worked as a consultant psychiatrist.
Okay. So, and currently you are you shift between UK and Pakistan both?
I do, yes. So I work both in UK and Pakistan. I have a private setup here in Pakistan with the name of CURELINK Healthcare.
Okay.
In Rawalpindi. And I also work in UK for NHS, National Health Service.
Okay. And can you tell us when CureLink was founded?
CureLink was founded in 2017 by two of my colleagues, Dr. Faisal Farid and myself, and then my other colleague, Dr. Abid Malik, joined as well. So we are all trained from United Kingdom. We came back to Pakistan, and we work between Pakistan and UK. We have all of us are specialist psychiatrists with different special interest fields. We provide services both inpatient, outpatient, as well as in the community.
Okay, that's amazing. So I think, sir, first of all, what I would like to know is why psychiatry? Why did you choose this field?
So basically, in 2003, I went to United Kingdom to get trained in public health.
Okay.
But then I got a chance to work in a mental health service, and I liked the idea to become a psychiatrist and work in mental health because of the holistic approach, because you need to know more people, you need to know the family, the friends, the culture, and everything about a patient, and that gives you more insight into difficulties that people can have in their day-to-day life. And I thought with the help from psychiatric training, I can try and help people more in different ways, not just by prescribing medication, but also by talking to them and getting them more support and help in different ways. And that's what attracted me more towards psychiatry.
Okay. And as you mentioned earlier, it's general adult psychiatry, right? So
Yeah.
do you also work with the children or like only adults?
Well, the main specialist training I had was in general adult, but we work with adolescents, so children who are becoming adolescent and then they move on to become adults. So we do
Okay.
work with a lot of families young children, and we also work with the families. So the parents are usually adults who have children as well. So, as a general adult psychiatrist, we are between the two ends of the life. So, young children,
Mm-hmm.
adolescents, and then old age after age of 60, and we do have interaction with all of them quite closely.
So obviously, both ages present its own set of issues, its own set of challenges. But maybe still, I sort of want to ask which age group is more difficult to deal with?
I think definitely general adult because it's a vast field. You
Mm-hmm.
see more complex, different scenarios, and with the adolescent there is a number of years and then they move on to general adult anyway, and a lot of the people who have difficulties as a general adult, they move on to become to have the same difficulties as an old age patient as well. So I think you do come across more complicated patients in general adult category.
Okay, okay. Um, Another question that I have is, okay, like you're a psychiatrist, right? But the general population is usually very confused between a psychiatrist and a psychologist. And they're like, okay, who do I need to go to? Like if I have an issue, if I have an issue regarding mental health, so where do I go? So can you please expand on that? Psychiatry, psychology, what's
Definitely.
the connection?
Yeah. Yes. So I mean, this is one of the questions that I do come across frequently in Pakistan.
Mm-hmm.
People do tend to ask, what is the difference, and so I have tried to come up with the more as simple answer as possible. So, psychologist is a person who is trained to provide psychological talking therapies and
Okay.
try to help people by talking to them or listening to them. But the psychologist cannot prescribe any medication. Psychiatrist is a person who is a doctor and trained as a specialist in psychiatric field, and they are able to prescribe medication, and at the same time they can do some psychological therapies as well. Because as
Okay.
a specialist training, we do get psychological therapy trainings as well. So in a way, you can say psychiatrist can be both psychologist and doctor, and the psychologist is a non-doctor person who helps, um, who is unable to prescribe medication, but do help by talking and listening to different people. In UK, obviously, we work in multidisciplinary teams where psychologists, psychiatrists, nurses all work as a team to help people. And that's what we are trying to achieve here as well in Pakistan, to build up like teams of people who can help together families and patients, whether they are adolescents or whether they are adults. And in that way, we can try and help them more.
Okay. So, as you said, it's sort of like a full team, right? So you'd have a psychiatrist, a psychologist, but you're also saying that a psychiatrist can sort of work like a psychologist as well, right? Can provide talking therapy. So in that regard, do you like say refer your parents to psychologists? And if you do, what is the response of the patients?
Yes, so basically, because psychology, as a psychologist, um, uh, I do believe that a psychiatrist should not always work as a psychologist, because a
Mm-hmm.
psychiatrist should try and focus on diagnostic assessments and medication prescription, and then trying to monitor the treatment as a whole. So I will still recommend more that people should go to psychologists for psychological therapies. But I do recommend that the initial diagnostic assessment for any mental health difficulties should be done by a psychiatrist, and the psychiatrist then suggests psychological therapies or medication or whatever is needed, and then the patient goes to a psychologist. So most of the common difficulties like anxiety, mild depression, anger difficulties, stress management, anger management, these things can be easily helped with by a psychologist.
Okay. But for depression, still people come to psychiatrists, right, for medication?
Yeah.
So it's
Yes.
only for like medication, like for example, a patient with depression comes. So as a psychiatrist, how would you treat him or her?
So, yeah, so what I do is I initially try to complete an assessment to make sure that the diagnosis is correct. If the depression is there, I will then discuss options of either only psychology or psychology combined with medication. So, because in a lot of cases, we don't need to prescribe medication, we can only just manage with psychological therapies as well. While in some cases, we need to do prescription of medication and do psychology. Research evidence suggests that combination of medication along with psychology helps more, and the prognosis is good if you do both of them.
Okay. Uh, but as you mentioned, okay, first you check if the diagnosis is correct, right? So of course that would mean maybe some another psychiatrist has provided a diagnosis, and for some reason or another, that patient is now with you. So I suppose my question is, what would you do if you disagree with another psychiatrist about a patient's diagnosis or a patient's care?
Well, I will obviously, first of all, I need to complete a detailed assessment to make sure
Mm-hmm.
that the diagnosis is correct. If the diagnosis is correct, I usually advise the patients to continue with the treatment that has been already in place. But if the diagnosis, because of any reason, is not correct, I try to explain that to the patients, the family, and give them information about how they can seek help or get help. So in that way, I explain what will benefit, what is the reason why I think the diagnosis is not correct, and what are the reasons why I think a different line of action or a different treatment may help the person.
So, usually accepting a diagnosis is obviously not easy, right?
No.
So, how, I suppose I would ask, what if a patient disagrees with your diagnosis or refuses treatment? How do you deal with that?
So again, the main thing is obviously is for you to explain. First of all, I need to be exactly clear about what is going on, and my assessment should be there. And based on my assessment, I need to explain the diagnosis in as a simple form as possible to the patient. So it will depend on patient's educational background, cultural background, how they understand, and how much they want to know. And once I am able to establish that, then I can explain at that level, um, and try to be as simple as possible. Another thing which I sometimes use is called formulation, which means
Okay.
I explain the patient's symptoms in a diagnostic way. So, for example, someone is suffering from depression or anxiety symptoms. I try to go into the symptoms and explain them in a way that they can understand the formulation, the reason why they are feeling in that way, the reason why those symptoms are happening to that person. And in most cases, once a person is able to understand the formulation and the symptoms, they will accept the treatment, because in the same way, you can explain the treatment why I am thinking that treatment will help them. So it's obviously a bit like, you need to spend time with the patient. And if you spend time, if you give them enough time and information, in most cases they do agree with the formulation and the treatment plan. Only in few cases when patients are very unwell, that their mental health can affect their judgment and understanding. So they may not have insight, they may not be
Mhm.
able to understand their symptoms because of their mental illness. In those cases, you need to get help from people who are around the patient, like family, friends, psychologists, any other doctors who are involved, and try to come up with a plan to help the patient in the best possible way.
Inshallah. Um, so I also want to ask that as you've been working both in UK and Pakistan, what's the, say, sort of disparity? Because people usually believe that only Pakistan is more concerned about the stigma associated with mental health, and they're hesitant to visit a psychiatrist or a psychologist, and the rest of the world is more open about it. So the first part of the question is that true? Is UK
I
really
don't,
more open?
yeah. So basically, I don't think that is true in that
Hmm.
way that it's just Pakistan, who people in Pakistan are more worried about stigma. The stigma issue is more cultural. So even people in UK, United Kingdom, who are more religious or who are more conservative, they also worry about stigma. So it's not just the country; it's more culture
More about
and how much conservative you are in terms of the family background, which leads to stigma type of issue. So it's not because of the country. So many countries where people are more conservative, people who are more who try to help within the families and stay together in groups or in closed communities, that's where the stigma problem is more prevalent. So whether that is United Kingdom, US, the United States, or anywhere else, the stigma issue is issue. The only thing is that the support and help available for stigma will differ. So in United Kingdom, there is more support, more help, and they have done a lot of work to reduce stigma as much as possible. In Pakistan, yes, maybe the support and the help is not that much as we would expect or we want to. So all of us have a very important role to reduce the stigma associated with mental health difficulties. Okay.
first. So as you're saying, okay, the support is not like available here to reduce the stigma, and obviously that sort of hinders people seeking care. So do you find that sometimes patients here don't like they don't sort of reach out for help on time, that they delay their treatment because of denial?
Yeah, definitely, and think so. So I do. So to think that because of stigma, a lot of people don't seek help, or they seek help in after a delay, and it is
Hmm.
more common in Pakistan, especially in closed families or women and children. To be honest, male young males are also affected. So young male are very less likely to seek help because they just try to help themselves first.
Hmm.
So these are the age groups which are mainly affected by the stigma issue in Pakistan. And just because of that, I would like to mention we have done some work, and some of my colleagues who actually introduced me to Creative Kinder House. I think Zainab, she's a speech therapist. So we
Yes.
did a lot of some work, especially with families who were coming here and tried to build that gap. As a speech therapist, she did work with us in CureLink at that time to help some of the families who were struggling to seek help, even for their children. And
Hmm.
that's how I came to know about Creative Kinder Horse as well, because she mentioned it to me, and that's how I'm here now to talking to you guys. So it's a very good forum, and it's a good opportunity for all of us to work together. And
Towards
I'm
you,
quite happy
definitely.
that I'm here to be able to talk to you guys. Yeah.
Thank you so much, doctor. Thank you so much. Um, as we were like talking, we've been talking about stigma and everything and patient care. So in UK, people of say even in joint families, they would approach care, right? Maybe not too delayed, but they would approach care. In Pakistan, there's this approach, this mindset that if you are living in a joint family system, you already have like a support system. You don't need to go to a psychiatrist and or a psychologist. That only people who are, say, sort of living in a, what do you call it, a nuclear family system. or living alone, they are the ones actually who need help with mental health. What do you say in response to that?
Yeah. So again, I don't agree with that.
Mm-hmm.
People who are living on their own or who have limited social contacts should have support and help regarding mental illnesses. Mental illness can happen to anyone. It can happen to people who have big families, who have support available, who are able to afford getting support. So these difficulties can happen to anyone. I do think the culture and the family system in Pakistan is very, very protective for people
Mm-hmm.
who have mental health problems. But again, that support will also need help, guidance, and appropriate treatment to be initiated. So even if someone is, for example, having a good family support, but the family members may not be doctors, they may not be psychologists, they may not be able to help as an expert for that person. So they can support the person to go to a doctor, to a psychologist, or to physician, but they cannot directly treat the person for any difficulties, or they cannot provide exact treatment that is needed. So I would strongly recommend still that yes, even if there is support available, even if there is family around, people should still seek help from professionals for mental health problems and difficulties.
Okay. So let's come to a bit of about the mental health disorders. Can you tell which from all the like your experience, which is the problem or disorder? I'm not sure how I should refer to it. Have you seen most in your patients?
Yeah. So again, this is quite a relevant question,
Mm-hmm.
and there is a difference between UK and Pakistan as well in that regard. So when I'm in UK, I see different kind of people with difficulties, and the presentations are quite different compared to Pakistan. And I think the same question people in UK ask me when I'm in Pakistan. They ask me what kind of illnesses are there. So there
Mm-hmm.
is a big difference. We do see more depression, post-traumatic stress, and chronic treatment-resistant mood disorders or psychosis in Pakistan. And amongst the mood disorder, the more common ones are anxiety, depression, and obsessive compulsive disorder.
Okay.
One of the disorders that we don't see here is personality disorder. I don't know whether you guys have heard about it that much. In European countries and in American countries, you do come across a lot of people with severe, enduring personality disorders, but you don't see those things here as much as you see them in those countries. And I think one of the reasons is the culture and the close family dynamics in Pakistan, which helps people not to get that many personality disorder difficulties. But we do see the other things like anxiety, depression, OCD, psychosis quite frequently here.
Okay. I was about to ask you, why do you think that is? Why there are not many personality disorders in Pakistan? But
Yeah, I
can you
think,
like for the viewers, can you
yeah,
sort of expand on that? What personality disorders are? Just a brief introduction.
yes. So basically, personality disorders is a group of behavioral problems which are part of your personality traits. And those problems become so frequent that they affect your day to day life. So, for example, some people have emotionally unstable personality disorder, and in those cases, they become emotional very quickly. They start harming themselves. They start doing very bizarre type of behaviors frequently. They become, so if those things are happening very frequently, they tend to become almost incapable of working and unable to do things like day-to-day life. They always seek attention, stuff like that. So that can be very detrimental to your mental state. The reason I think is, I don't obviously have a research evidence, but the reason what I think is because we have close family system, and we try to help people as a family and friends, and we do give them attention from any way. So people don't tend. need to seek help from services like National Health Service or social services for that regard. So you already have family or friends around you who can help you in emotional difficulties, acute stress, or impulsive behaviors. While in other countries, the family don't deal with it; they just leave the services to deal with it.
Okay. Okay. Thank you. Um, as you obviously deal with issues of stress and anxiety and everything, and seeing the current situation, COVID is like happening. We are going through a pandemic, and everyone is really confused. So I suppose I would, but as you know, KKK deals with special needs, and we would like to know, okay, in this time, in this difficult time, what advice would you give to parents um, with special needs children during this time to cope with mental stress?
Yeah. So again, the stress is for everyone. It will affect everybody, whether it's adult kids, whether kids with special needs or just normal kids. So I think for parents, it's a difficult time, and I think it's not just for people who are having special kids at home.
Mm-hmm.
For generally for every parent, it is a difficult time because of the COVID-19, the spread, and because people are currently housebound and
Exactly.
they need to look after the kids. They need to make sure that the needs of the kids are met appropriately. So in a way, the parent will need to become a teacher as well as a cook, as well as a parent, as well as a sportsman. Everything. So you have to do different things to be able to support and help your child, whether they have any special needs or not. And special needs child will obviously need more help and more support. There are online courses and stuff available, even free of cost as well, which the parents can seek guidance from. One of the I think one of the more helpful one is the Royal College of Psychiatrists website. They have different helpful guidelines available that people can seek and read and then get some more guidance from them as well. One Another thing which I would like to mention is to keep a routine at home. Even if you are stuck at home, you are unable to go out, try to have a routine, stick with the time of going to bed, waking up in the morning, then having a bit of teaching, some homework, some exercise, some games, indoor games, outdoor games, stuff like that. So if you can have like a structure of these things all day long, that will help both for the mental health as well as physical health of your child. But and another thing is always make sure that you seek help. You talk to people over the phone, or there is so much information available online which will also help and guide you. If there is any problem with medication that your child is taking, just stick with the doses that is prescribed, and make sure that you have plenty of supply available at home, so you don't run out of medication, because obviously special need kids will need medication if they are on any medication at that time.
Yeah.
So that, I mean, the general advice is to obviously try and get support from online courses and a routine and a structure of the day.
Okay. Amazing. Uh, earlier we were talking about having a holistic approach, and that also involved having the family members involved, right? Okay, because one person's behavior would affect the family unit as well. So, first, my question is, in your experience, in your years of experience, do you think that parents' behaviors and their actions affect their children, and
Definitely.
how severely that is?
And as you said yourself, that the family unit is a very important unit, very important learning unit, a very important behavioral structural unit as well. So
Mm-hmm.
all members of the family, whether parents, grandparents, brothers, sisters, uncles, niece, nephews, everybody is very important as a family member, and the behaviors of the parents will obviously be more important affecting the child. It will also depend what age of the child is. So if parents have a structured structured approach, if they have understanding amongst each other, if they discuss whatever they do, whatever helps frequently amongst each other, that will help, and that will have significant impact on the child on day-to-day basis.
Okay. A question I received is, okay, how do I control my negative thoughts? That's a general question that's asked. Like if someone is having negative thoughts, what should
Yeah.
that person do?
So you need to understand. Yeah. So basically, negative thoughts are automatic thoughts that come into mind. You cannot stop them. They are
Hmm.
spontaneous. So they do come to your mind. The important thing to understand is that negative thoughts depend on mainly three aspects of your psychology. One is mood, the second is behavior, the third is emotions. So if you are able to monitor these three aspects of your psychology, you will be able to modify or control response to any negative thought. I usually try to give a very simple example is that if you are going out somewhere and you are not feeling very good, you are feeling depressed or angry or frustrated, and then someone comes in front of you who is a known person, who is your friend or a family member, and they don't look at you or they don't say hello, they don't say assalamu alaikum. So most likely the negative thought which will come into your mind is that this person doesn't like me, and he's my is not a friend anymore. So that will be the negative thought, which will depend on your mood. So if your mood is low, if you are frustrated, tired, angry, that is what you will get immediately in your mind, most likely. But if you are happy, if you are settled, if you are not angry, there is no problem in your mood, then possibly you will think that this person has not seen me, and this person is somehow busy, and that's why did not look at me, and then you will most likely go and say hello to that person. So this is how your behavior, mood, or emotions can affect your negative thoughts. So if the behavior is to isolate yourself or stay away from people, the negative thoughts will increase. But if you go and meet people and try to interact with people and talk to people, the negative thoughts will automatically reduce and get into like positive thoughts. Another helpful way is to keep a diary of your negative thoughts. Whenever a negative thought comes to your mind, you note it down and then try and think about alternative option. What would be a positive thought in front of that negative thought? So in this practice, you will reflect more towards positive thoughts. So this is the basis of cognitive behavioral therapy that we use in psychology. Something
Okay.
called CBT, which is again available online, and a lot of information is there online as well. Okay.
Okay. Thank you so much. So my next question is sort of like you would have dealt with so many patients. Can you like just is there any experience that sort of like profoundly affected you, and like made you realize, okay, yeah, I am in this field and I'm in this field for a reason. Is there any experience you can share with us?
Right. So I don't have any specific examples in terms of the field, but since I came back to Pakistan, I do feel that in a way, I feel like my experience of both UK and Pakistan does help me to be able to help people a bit more, and I do spend more time in psychoeducation, because a lot of people just think that medication is the answer, and they expect me to prescribe at least 4, 5, or 6 different types of medicines, which I tend not to do. And then I do spend time to psychoeducate people, and then there are changes. People do tend to understand gradually with the passage of time, and that's where you think like that, yes, I have done something differently, and that different action did help people. And that in a way you can say that give you an idea that yes, there is a reason why I am in this field and why I'm in Pakistan as well.
Amazing. And like from 9 years, 10 years back to now, obviously changes happen. So do you like have noticed a change regarding mental health and regarding seeking help?
I mean, there is a huge change. I do think people are more educated, more understanding of the mental health problems. I do think people are now seeking help more often for mental health problems compared to the past. And I do also think that people do understand the self-seeking, self-help groups. So it is a lot easier to educate and discuss treatment options with people now compared to when I
Mm-hmm.
initially started many years ago. At that time, it was very difficult to explain even a simple antidepressant to people. Now I can even explain complex psychological therapies to people, and they do understand. People do tend to reflect and read about things, tell them, and then at the same time, people do tend to accept that medication should be used less compared to when we used to prescribe, two or four, three or four medications at the same time. I have seen people now themselves don't want to be on medication that frequently now as compared to before. So there is, I think, a big change in terms of understanding what people want, how they can help themselves, and that they seek help and understand their difficulties in a more better way.
So my next question is like related to this actually. As you said, Kay, you have noticed a change and people are becoming more aware and they don't want to be on medication more. But how say how does this apply to the socioeconomic classes? Like is this change only in the educated class or like the elite class, or does this apply to the other classes as well? Do they also want like less medications and more therapies? Does that still work?
I think obviously there is a difference that more people who are educated, they do tend to read and understand about information compared to people who are maybe from lower income or who are not educated or from are a bit slightly older generation than us. But I do there is not a huge difference.
Mm-hmm.
I do see people from even who have been on medication for 20 years, more than 20 years, but they do want to come off it now and try other ways of helping themselves. But I would say that yes, educated class, they are more in favor of less medication and more psychological therapies at this moment of time.
Okay. So we have a question in the comments. I'm just going to take it. Kinza Sadaf is asking how diet is related to mental wellness and asking with respect to kids and adults. Autism and diet. Is there any data backed by research?
Yeah. So basically, yes, diet is important for mental wellness, and it applies to both kids, adults. Um, there is evidence that in depression and with some medication, the appetite increases. So you tend to eat more, and something we call comfort eating.
Yeah.
In the same way, some people, when they are stressed or when they are anxious, they tend to eat or drink or eat more, or they may go for coffee, smoking, they may go for tea and different kind of things, and they may not look after their diet pattern that well. So it will apply to both kids and adults. So healthy diet, a combination of fruits, vegetables, meat, milk and stuff like that will be always a very good option for a good mental health for any age. Now, in terms of autism and diet, there is obviously there is, as far as I'm aware, I don't think there is any specific conclusive research available. There are some evidence-based medicine, some doctors or some scientists who are involved in autistic spectrum treatments. They have suggested that maybe some diet patterns do affect autism. Especially people talk about chocolate. or anything which is more sugary, like sugar fizzy drinks, chocolates, that increases the hyperactivity in patients with ADHD or autism. But again, as I said, there is no conclusive, as far as I'm aware, there is no conclusive research evidence. But they do feel that chocolate related stuff, or caffeine, these things may possibly affect or increase the hyperactivity of a child who already has ADHD. Um, the autism is more, and ADHD as well, and schizophrenia. The new research suggests that there is more link with the genetic prevalence as well, but we don't have any conclusive research. These things are very, very difficult to research as well because of the ethical boundaries and obviously the cases as well. Yeah.
Okay. Okay, thank you so much. Doctor, thank you so much for joining us today. This has been really informative. I would like to end this with, like, I want to ask you, what advice would you give to people in general who are not seeking help, basically, who are delaying it for some reason or another? What would you say to them?
Well, I would again say that they should actually seek help if there is any difficulties. It doesn't matter whether it's a very mild anxiety, very mild symptoms. So if the symptoms are mild, it's better to get treatment, which will again be very like you probably will only need a very small, low-level psychological therapies, and hopefully will not need medication if the symptoms are mild. But as soon as you seek help, the quicker you get help, the quicker the response and the good will be prognosis. Because if even that, even if then, because for any reason you're unable to seek help, there are other ways to seek help confidentially as well, like privately. For example, going on internet, going to credible websites like Royal College of Psychiatrists, or medical university websites which are credible. So you can always seek information from them, and then try to use sensible and structured information from those websites and try to help yourself. So it's not always a bad idea to help yourself or to seek self-help groups, but the best option is to go and seek help from professionals as soon as possible.
Okay, thank you so much. Thank you so much, Doctor, for joining us. It's been a pleasure to have you.
And I would like to thank you as well for the questions and this opportunity. And again, as I said, Zainab introduced me, and I would like to thank her as well by yourself to that I've been introduced to Creative Career House. So thank you very much.
Thank you. Allah Hafiz.
Okay, take care. Thank you. Allah Hafiz.